in the lateral groove for the blood supply of this region will come by next semester the cerebral medial artery. If will be clot, if will be, do you see, necrosis, if will be clot, do you see, if will be contraction of the vessels, will be necrosis, do you see, of the tissue. And person will have central paralysis, which is characterized by mobility dysfunction and by sensory dysfunction. For example, I will push her by needle. She will say, no, like fly walks here. Maybe opposite. The fly will walk here, and she will say, it's very acute pain. And do you see the muscles will be paralysis. For example, you will ask the patient, do the flexion of the fingers. Look at me. Do you see? This is hypokinesis, very smaller mobility. This will be central paralysis. Central paralysis is different than the peripheral. What is the central part of the nerve system? What? Brain and spinal cord. And peripheral part, the all cords, nerves, do you see, which direct out. They complete into the plexus, or the all nerves which exit. What is peripheral paralysis? Like your association, cutting of the nerve, nothing. This will be anesthesia, this will be atrophism, because do remember each nerve includes the vegetative portion, and akinesia, 3A. If will be, this is peripheral paralysis, not any information, any order will be present near this region. If will be central, this will be hypo or para, abnormal, do you see? Did you understand? Okay. Listen to me. Here in the superior parietal lobule will be the, do you see, head without eyes. I will take, without vision control, any object. By my hands, I can get this, do you see, two, do you see, plates, do you see, which, do you see, by pressing can have, do you see, the changing of the positions. This is material, this is metal, do you see, and I can get many informations about many characteristics. I can get information about it. This is stereognosis, the taking of the information by hand about, do you see, objects. Stereognosis. Here, this is my, do you see, right hemisphere. Decide about following. You can see this is one upper limb, this is another upper limb, and this is third upper limb. This is my fantasy. Listen, this is topognosis center. Topognosis center, this is center of the scheme of the body. When I was student, no more than 47 years ago, do you see? And we was in the hospital on department, do you see, for the special persons with abnormal consciousness. And our teacher, he is doctor, he invited patient and put on the table 3 glass bottles and said, Pete, please take these bottles and put on another table. He, do you see, took one bottle, he took another bottle, he thought about third hand, he wants to take another, and they're all bottles full. Maybe opposite. Maybe he will take one, will change position, will take another, will change position, will take the third, will change position. This is individually for what? And another, this is scheme of the body. The teacher gave us, students, the patient and said, speak with him, take the anamnesis of his life, of his disease, and produce diagnosis. We had speech with them alone of the 1.5 hour, and we thought about our abnormal consciousness. He answered very correctly on all questions. And when we were ready to get the bad marks because we didn't produce diagnosis, we asked him, what do you do here in this hospital? He said, I wait for the operation. What operation can be in the special hospital for the persons with abnormal consciousness? He cannot be operation. And what operation? I have here the liver, I have here the stomach, and here in the center between them is woman. She jumps, she dances, and I cannot sleep because every time he produces discomfort for me. Because he had, do you see, in this scheme, do you see, in the center of the scheme of the body, has any distraction or dysfunction, I don't remember, and his fantasy draw, do you see, the image like a woman. Did you understand? No, I gave these examples. Another, in the supramarginal gyrus. What is it?
Spoon.
Spoon. For what?
Soup.
Yes. Look here. The pen for what?
Writing.
The shovel.
Digging.
Listen to me. You know information about function of the objects. How you got? By vision. Do you see? And for example, if you will take the smaller baby, yes, you will give him the more of elements. He can do you see, push to the table. He can take into the mouth because he doesn't know about their functions. Did you understand? And we will train him, and he will get information about these functions. Again, example from my study in life. Doctor with group goes into the room of the patient, into the patient room. And he saw the nurse which brought the medical codes for the patient. And doctor said, give me, I will give for the patient. He, together with us, came into the not classroom, into the patient room, and put on the table his jacket and trousers, and tried to speak with us. The patient took the trousers, looked at them, and put on the bed. Took the jacket, looked at it, and put on the bed. Doctor rotated for him his body and said, Pete, why you didn't dress the coats? Please, dress. He took the trousers and dresses on the head. He forgot the function of these objects. He does the order about which the doctor informed him, but he doesn't know how. Do you see? Listen to me here. In the angular gyrus will be the book. This is reading center. Reading center. We train our, do you see, baby. These are symbols of the elbow, do you see? And if, do you see, we will collect some symbols, we will do the parts of the words. If we will collect the words, we will produce, do you see, the speech, do you see? And we train our baby. And he tries to read. Do you see? This is reading center. And now you are doctor. You work with patient, you are busy, and the time is evening, you won't go home, and another patient came. And you want to decrease the time for the, do you see, speech and for the working with him, and you gave him, do you see, the paper and said, please, Shahrukh, include in this paper your name, your surname, your address, your age. And he sits and says, I cannot read. I cannot complete the card. I cannot complete the card. Where is problem? Where is problem? And if he cannot write,
Don't write.
you must differentiate the reading center and reading center. And how you will differentiate? You will give him the any text and you will ask to read. If he can, do you see? Here, do you see, is normally. If he cannot,
Then that's
you must, do you see, you understood this is problem, but you must check here. And he cannot write if he doesn't know alphabet, do you see? Because what you will ask him? You will ask him, no, draw easy scheme of the, for example, mushroom, of the, for example, green tree, do you see? Of the scheme of this primary or very easy house, do you see any scheme? Draw the oval, draw the round, do you see? If he cannot write, here will be problem. If he cannot draw and cannot read, here will be problem. Listen to me, this is ear in the temporal superior gyre. This will be ear, this is hearing center. If here will be distraction, the patient will not listen, will not differentiate sound. Did you understand? Maybe he will not differentiate the some stages of the some levels of the sound. Maybe any micro sound, maybe any big sound. Do you see? But here in the posterior part will be person, which speaks with another person. This is understanding center. You speak with patient, you ask him, what is your name? He says, I want to walk. But he can complete correct position of the words in the speech if he has a very short time from distraction. Did you see? If this time more than the 24, 28 hours, you will ask him, what is your name? The car, bread, works, book, brain, collection of the different words, different words, do you see? They will be the characteristics of the some objects, this will be any objects, this will be any functions, and all will be mixed and they don't have connection between them. This is called speech soup. Because how you cook the soup? You complete the some vegetables, do you see? Because this will be peach soup, do you see? This is hearing understanding center. Here will be, do you see, person on 4 limbs. This will be equilibrate center. Because without control of my eyes, I know, I sit, I stand where I place the parts of my body. Do you see? Without my, do you see, vision control. If, do you see, here, do you see, will be distraction, do you see, here will be problem with the equilibrate center and the patient cannot walk. Why? Because he doesn't know how it is located, do you see? These centers are placed on the lateral side of the brain. On the do you see, medial side of the brain, you can see this is lateral groove. This is lateral groove. This is callosum body. This is callosum body. You can see this is callosum body. Here will be cingulum gyrus, which, do you see, by parahypocam gyrus continues to the medial side of the temporal lobe. And do you see, it will rotate and this will be hook, uncus. Do you see? Cingulum gyrus. Cingulum is translated belt. Do you see? Parahypocam gyrus. Hypocamp, this is seahorse. Shape. Do you know seahorse? Do you see? And do you see? And this is a hook uncus. This is end of the parahypocam gyrus. Here, do you see? Here will be what? Parieto-occipital groove, primary groove. Do you remember lateral, central? Do you see? Central, lateral, and do you see parieto-occipital, these are primary gyruses. Look us here, what shape of the medial brain which parieto-occipital groove cuts? Not. No, it is like triangle, but it is called, do you see, cuneus, cune shape, cuneus, do you see? And this parieto-occipital groove cuts cuneus, and from it cuts base, precuneus, do you see? Here, on the medial side will be very deep groove, do you see? Very deep groove. It is called calcarine groove. Calcarine groove. Do you know the foot of the bird? Do you see? This will be 3 fingers and this very short. Like, do you know, from the history army, the officer has boots. Do you see? Has boots. And here was, do you see, like star. Do you remember?
Yes, ma'am.
And do you see, this will be a groove which has name calcarine groove. This is calcar. Do you see? And you can see here around of this groove is gray matter in which is placed what is it? TV. Yes, TV. Vision center. It is placed in the occipital groove. My dear, very often when the person falls by occipital region, he has, do you see, the dark condition, do you see, between, in front of, do you see, or maybe like stars fly out, do you see, because here, do you see, will be disposition of the neurons, because, do you see, when you will fall, there, do you see, connection between synapses for some time will destroy, do you see? This is vision cortical center. And in the 5th layer, I will do differentiation by this moment. For example, do you see, I see the workbooks, the some things, the all things around me. Do you see? By 4th layer, and you remember 6 layers, yes? By 4th layer, I have vision memory. For example, I know this is Sharuk, this is Ankita. Do you see? How? Because I located by last information the vision memory into the 4th layer. Listen to me, this is uncus. This uncus this is smelling center. Smelling center. Again, I can examine the some ears now, but for example, if now will be formalin, I understand by 4th layer this is formalin, because by last time I got, do you see, this information and I put it into the 4th layer of the uncus. My dear, only this centers, or here is free, here is free, here, do you see it's free? Only this centers we know in the brain. Did you understand? What time is now? 1. Так, my dear, do the test.